If you're finding yourself maybe more tired than usual or feeling a bit dizzy sometimes, maybe getting those annoying leg cramps when you walk, especially if you're, say, over 60. It's easy to just brush it off, right? Like, oh, I'm just getting older. But sometimes those little signals from your body, they could be whispering about something, well, a bit more significant. Often they might point towards what people commonly call clogged arteries. Now, I know that phrase itself can sound pretty scary, like some kind of sudden plumbing emergency in your body. But here's where our deep dive really starts today. Our sources show that this issue, medically, it's called atherosclerosis. It usually isn't sudden at all. It's actually something that builds up really slowly, often silently, maybe over decades. And for a lot of us, particularly after age 65, it becomes a much more, present concern, sometimes without obvious symptoms until it's quite far along. Okay, let's unpack this. Our mission today is to really cut through some of the noise, the popular ideas, maybe even some myths, and understand what the latest research and solid health information actually tells us about managing and hopefully preventing arterial plaque. And this deep dive, it's specifically tailored for you, focusing on the insights most relevant for folks, especially those 65 and older.
That's a great way to frame it. And what's fascinating here is exactly what you touched on. When we talk about clogged arteries, medically, we mean atherosclerosis. It's a chronic condition, progressive. Basically, deposits of plaque start to build up inside the walls of your arteries. Think of plaque as this mix of stuff, cholesterol, other fatty bits, calcium, cellular waste. So imagine your arteries are normally like smooth, flexible hoses. This plaque buildup makes them thicker, harder, less flexible, and that naturally restricts how well blood can flow through them. And as you highlighted, the risk of this plaque buildup, it really does jump up significantly after age 65. So yeah, it's a really important topic for this age group.
Makes sense. It's not just wear and tear then, it's this specific buildup process.
Exactly. And if it's left unmanaged, the consequences can be quite serious. It really depends on where the plaque builds up. If it's in the arteries leading to the heart, it can cause a heart attack or angina that's chest pain. If it affects the arteries going to the brain, well, that can lead to a stroke. In the lungs, it might cause something called a pulmonary embolism. And if it's in your arms or legs, we call it peripheral artery disease.
Wow. Okay. So different locations, different major problems.
Precisely. And the really tricky part, and why awareness is so key, is that you might not have any symptoms early on. Often things only become noticeable when the condition is, well, pretty advanced. That's why understanding prevention and management is just so vital.
Right. So if someone does have symptoms, or maybe they've just heard the buzz about unclogging arteries.
Yeah.
That idea of a quick fix must sound incredibly tempting. You see it online, right? These headlines about specific foods or, miracle remedies that promise to just dissolve everything away. Is that even possible?
Yeah. That's a really critical question. And stepping back to see the bigger picture, reputable medical sources are quite clear on this. There are no specific foods or magic treatments that can literally unclog arteries or fully reverse atherosclerosis once that plaque has really solidified. That idea of a quick fix, it's a very common and honestly a persistent misconception.
Ah, okay.
Yeah.
So the dream of just eating something to make years of plaque vanish.
Yeah.
Not realistic.
Not really, no. The true focus, the scientific focus, isn't on somehow dissolving existing blockages like that. Instead, the real goals are, first, prevention for people who don't have significant plaque yet. Second, slowing the progression for those who do. And third, really importantly, promoting plaque stabilization and maybe even some regression.
Stabilization and regression. Okay, what does that actually mean?
Good question. So while complete reversal making established plaque totally disappear isn't generally on the table, what is possible, and this is a tangible goal, is changing the plaque's volume, making it smaller, and altering its composition to make it less dangerous, less likely to rupture. Think of the plaque not just as a hard lump, but as a structure that has different parts, some more unstable than others. Intensive treatments can actually change its internal makeup.
Okay, that's a different way of thinking about it. Not just getting rid of it, but making it safer.
Exactly, making it less vulnerable. Which naturally leads to the important question, what strategies can actually help us manage and improve arterial health, especially as we get older?
That's a much more hopeful and actionable perspective. Not unclogging, but preventing, slowing, stabilizing, maybe shrinking a bit. Okay, let's dive into diet then, because our sources really point to diet as being absolutely fundamental.
Absolutely, it's a cornerstone. And it's really about a whole diet approach, not just, one magic food. When we look at what to limit or avoid, unhealthy fats are right at the top. We're talking mainly about saturated fats, mostly found in animal products like beef, pork, full-fat dairy, but also in some plant oils like coconut and palm oil. And then there are trans fats, which ideally you want to cut out completely.
Why are those fats so bad for arteries?
Well, they significantly increase your LDL cholesterol. That's the bad cholesterol. It's a major building block of plaque. The American Heart Association actually recommends keeping saturated fats to less than 6% of your total daily calories. So not much.
Okay, less bad fat. What else?
High salt intake is another big one. It's strongly linked to both atherosclerosis itself and high blood pressure, which puts extra strain on arteries. The World Health Organization suggests keeping sodium under 2,000 milligrams a day. That's about 1 teaspoon of salt total.
And that includes hidden salt in processed foods, right?
Absolutely. It adds up fast. We also need to be really mindful of added sugars and refined carbohydrates. Think sodas, sweets, lots of processed snacks, white bread, white pasta, white rice. They can fuel inflammation and weight gain, both risk factors. And finally, limiting processed and red meats, things like bacon, burgers, ham, salami is generally advised, along with moderating alcohol.
Okay, so that's a fair bit to cut back on or watch out for. But it's not just about avoidance, is it? What should we be actively adding to our plates?
Exactly. It's just as much about what you do eat. The champions here are definitely plant-based foods. Load up on whole vegetables, fruits, whole grains. These aren't just vaguely good for you. Think about it.
All right.
The fiber, the antioxidants in these foods actively help combat the inflammation that drives plaque buildup. Diets rich in these are linked to lower rates of diabetes, high blood pressure, lower saturated fat intake, hitting all those key risk factors for atherosclerosis.
Makes sense. What about oils and fats? We cut the bad ones. What are the good ones?
Healthy oils are key. Olive oil is a classic example, a cornerstone of heart-healthy diets, like the Mediterranean diet. But also oils like canola, corn, sesame, sunflower, soybean oil, they help improve your cholesterol profile. Olive oil in particular is great for helping maintain artery flexibility and reducing that stickiness that lets plaque grab hold.
Okay, olive oil. Got it. What else?
Fatty fish. They're packed with anti-inflammatory omega-3 fatty acids, which are super important for heart health. Think tuna, salmon, mackerel, herring, anchovies. Aim for maybe up to twice a week. Just be a little mindful of fish that can be higher in mercury, like swordfish or marlin. Limit those.
Good tip.
Nuts are another fantastic addition. They've got protein, fiber, healthy fats, things like hazelnuts, almonds, pecans, walnuts, pistachios. Just watch portion sizes as they are calorie dense. A small handful is usually a good serving. And don't forget legumes, beans, and pulses, black beans, lentils, chickpeas, kidney beans. They're excellent sources of protein, vitamins, minerals, great meat alternatives.
Right, like using lentils instead of ground meat sometimes.
Exactly. And finally, whole grains. Choose whole grain bread, brown rice, whole wheat pasta, oats, quinoa over the refined white versions. They have more fiber, help balance blood sugar. Aim for them to fill maybe about a quarter of your plate.
It sounds like those famous diet patterns, the Mediterranean or DHA sachets, really embody these principles.
They absolutely do, and there's good evidence for them. There was one significant study really relevant for our listeners. It followed people aged 55 to 80 who were already at high cardiovascular risk. Those who followed a Mediterranean diet had significantly fewer major heart events, heart attacks, strokes compared to a group eating a standard low-fat diet.
Wow. That's compelling evidence, especially for that age group.
It really is. It shows the long-term power of these whole food dietary patterns.
Okay, that gives us a great map for overall diet. But, you often hear about specific ingredients being singled out, like in home remedies or health blogs, things like garlic or turmeric. Let's look at some of those that came up in our sources. How do they actually fit into this picture of prevention and stabilization rather than, unclogging?
Right, good point. Let's break down a few. We can group them maybe by how they help. First, some are really good at fighting inflammation and oxidation, which are like the sparks that help plaque form and grow. Take apples. They contain polyphenols, which studies suggest help reduce arterial hardening and lower oxidized LDL. That's the really damaging form of bad cholesterol. Then there's garlic. It's a bit of an all-star. Research suggests it can help prevent plaque buildup, make blood less sticky so it's less likely to clot, and help lower both total and LDL cholesterol. Garlic might also help relax blood vessels and lower blood pressure.
Garlic sounds pretty powerful.
It has a lot going for it. Turmeric, too. Specifically, its active compound curcumin. It's a potent anti-inflammatory and antioxidant. It helps fight oxidative stress, may help dissolve stored fat, relaxes blood vessels, lowers blood pressure. And here's a useful tip. Adding a little black pepper when you eat turmeric dramatically increases how much curcumin your body can actually absorb.
Oh, interesting. So piperine and black pepper helps the curcumin work better.
Exactly. And black pepper itself acts as an antioxidant, fighting off those damaging free radicals.
Okay, so those help with inflammation and protection. What about things that help circulation or vessel health directly?
Good category. Olive oil, as we mentioned, is rich in those healthy monounsaturated and polyunsaturated fats. They improve your cholesterol profile, lowering LDL, potentially raising HDL, good cholesterol. That HDL is important for something called cholesterol efflux, basically helping to pull cholesterol out of artery walls. Cayenne pepper is another one known for circulation. It seems to help strengthen blood vessels, might reduce plaque formation, dilate vessels, and lower blood pressure. And lemon, rich in vitamin C and flavonoids. These act as antioxidants, protecting artery walls from damage and reducing inflammation. It's also linked to lower cholesterol levels.
And that's a really helpful breakdown. It shows how these individual ingredients can support the bigger picture of heart health without making magical claims. But it's really important to stress a note of caution from our sources, especially for our listeners over 65, right?
Absolutely crucial. If you have any existing heart conditions, maybe a recent heart attack, ongoing chest pain, shortness of breath, palpitations, dizziness, cold sweats, or if you're taking blood thinners like warfarin, you absolutely must talk to your doctor before adding new remedies or making major dietary changes, even with natural ingredients.
Right. Things like garlic or cayenne can interact with medications or might not be right for certain conditions. Better safe than sorry.
Always. Your doctor knows your full health picture.
Okay, so diet is huge. But it's not the only piece of the puzzle.
Yeah.
What else is critical for keeping arteries healthy long term? Especially think about that 65 plus time frame where risks are higher.
Yeah, looking at the wider picture, arterial health is truly a whole lifestyle commitment. Diet is key, but other things are just as vital. Regular physical activity is absolutely non-negotiable. It helps you maintain a healthy weight, strengthens your heart muscle, makes it more efficient, all of which reduces plaque risk. Think of exercise as helping keep your arteries flexible and responsive.
What kind of activity are we talking about?
The general recommendation is at least 150 minutes of moderate intensity activity per week. That could be brisk walking, jogging, cycling, swimming, even playing tennis or doing aerobics. Plus, adding strength training a couple of times a week is also important. And remember, obesity itself is a major risk factor for plaque buildup and heart disease, so activity helps manage weight too.
Okay, move more. What else?
Stopping smoking. If you smoke, quitting is probably the single most impactful thing you can do for your arteries and your overall health. Smoking directly damages artery walls and massively accelerates those fatty deposits. Studies even show quitting can help stabilize existing plaques, making them less dangerous.
That's a powerful incentive to quit.
Huge. Then there's managing stress. Chronic stress really can increase the risk of atherosclerosis. Finding healthy ways to cope is important. Things like yoga, meditation, deep breathing exercises, spending time in nature, whatever works for you.
Stress is sneaky, isn't it? It affects us physically more than we realize.
It really does. And of course, managing other health conditions is critical. If you have high blood pressure or diabetes, keeping those under tight control is essential. Diabetes, for instance, can actually interfere with how well some cholesterol medications, like statins, work to stabilize plaque. So management is key.
It's all connected.
It really is. Also, thinking about antioxidant therapy, basically, getting plenty of antioxidants, mainly through diet, is valuable because that oxidative stress we talked about. It's a major driver of plaque formation and makes existing plaques less stable.
So lots of colorful fruits and vegetables again.
Exactly. And our sources also mention some herbal teas and juices that can be beneficial as part of a healthy lifestyle. Green tea, for example, has catechins, antioxidants that help lower LDL cholesterol and protect blood vessels, keeping them flexible. Ginger tea contains gingerol, which helps reduce inflammation in blood vessels and improve circulation. Hibiscus tea is rich in different antioxidants that help relax blood vessels, lower blood pressure, and can also help reduce LDL and triglycerides.
Hibiscus tea for blood pressure. Interesting.
Yeah, there's some good research on that. Beetroot juice is another one. It contains nitrates that your body converts to nitric oxide. Nitric oxide is fantastic for relaxing and widening blood vessels, which lowers blood pressure and improves oxygen delivery. Just a heads up with beetroot, start with a small amount, maybe half a cup, as it can be potent. And if you have kidney issues, check with your doctor because they oxalates.
Good to know. Any others?
Pomegranate juice is also packed with antioxidants. It helps fight oxidative stress and inflammation, boosts that helpful nitric oxide, and can lower LDL cholesterol. The key here is to get 100% pure juice with absolutely no added sugar.
Okay, so lots of lifestyle tools in the toolbox, but sometimes lifestyle changes alone aren't enough, especially if plaque is already quite advanced, right? That's where medical science comes in more directly.
That's exactly right. Lifestyle is the foundation, always. But medical interventions are often necessary and incredibly effective, particularly as we age and risk increases. Doctors have several tools. There are medications like antiplatelet drugs, think aspirin, to make blood less sticky, anticoagulants like warfarin for certain conditions. Critically, there are powerful cholesterol-lowering medicines, primarily statins, and also newer drugs, and medications to control blood pressure.
And if medications aren't enough, or there's a severe blockage,
Then surgical treatments might be considered. Things like balloon angioplasty, where they inflate a tiny balloon inside the artery to open it up, often leaving a small mesh tube called a stent to keep it open. Or, in more extensive cases, coronary artery bypass surgery might be needed, where they create new pathways for blood to flow around the blocked sections.
right. But you mentioned something earlier that sounded really cutting edge.
Yeah.
About plaque stabilization and regression, not just managing symptoms, but actually changing the plaque itself.
Yes, and this is where it gets really interesting, especially for patients who already have atherosclerosis. This is the frontier of current treatment. The focus, scientifically, has shifted. It's less about the old idea of unclogging and more about stabilizing existing plaque and achieving regression, meaning actually shrinking its volume, the core concept. Advanced therapies aim to fundamentally alter the plaque size and its internal structure, its composition, to make it much less likely to cause a sudden event like a heart attack or stroke.
So how do they do that?
The absolute cornerstone is aggressively lowering LDL-C, that bad cholesterol. Statins are workhorses here. They significantly reduce the overall volume of plaque. We can measure this with the Bechtel imaging techniques, looking at things like percent atheroma volume or PAV, and we see even greater reductions in plaque size, and importantly, in heart attacks and strokes when we use combination therapies, like adding another drug called ezetimibe to a statin, or using the very powerful injectable drugs called PCSK9 inhibitors. These combinations can drive LDL levels really low, and the data is clear. Even a 1% reduction in that plaque volume measurement, PAV, is linked to a significant drop in major adverse cardiovascular events.
So shrinking the plaque size helps, but you mentioned composition too.
Yes, and this might be even more important. Intensive lipid-lowering therapy has a profound effect on the plaque's internal architecture and its stability. Key changes happen. The dangerous, soft, lipid-rich core of the plaque, the part most likely to rupture, actually shrinks. At the same time, the protective fibrous cap over that core gets thicker and stronger. Think of it like reinforcing a weak wall. A thick cap means a much more stable plaque.
Okay, so less bad stuff inside, stronger cap outside.
Precisely. These therapies also tend to promote a more stable type of calcification within the plaque. Not all calcification is bad. This stable kind is actually a marker of healing and stability, unlike unstable little specks called microcalcifications. And finally, these treatments reduce inflammation within the plaque itself. They calm down the inflammatory cells that make the plaque angry and unstable.
Wow. So it's not just about lowering a number in a blood test. It's about fundamentally changing the danger level of the plaque that's already there.
Exactly. That's the bottom line. Consistently lowering LDL cholesterol, especially getting it down to the target levels your doctor recommends, provides profound benefits for patients who already have atherosclerosis. It stabilizes the plaques, reduces their vulnerability, and leads to much better, safer long-term outcomes.
That really shifts the perspective. Before this deep dive, I sort of pictured plaque as just inert gunk. But understanding that treatments can actually change its structure, make it safer, that's incredibly hopeful. Okay, so to wrap up our deep dive for you, our listener, the appealing idea of just unclogging arteries. While it sounds great, the real power, the scientific power, lies in consistent, evidence-based strategies. It's really about prevention, if you can, slowing things down if plaque is starting, and crucially, fostering plaque stabilization and even regression through proven methods. And this is all especially vital for you, particularly as cardiovascular risk does naturally climb after age 65. We've seen how huge a comprehensive approach is embracing that heart-healthy diet, really committing to those proactive lifestyle changes like exercise and not smoking, and understanding when medical help is needed and how effective it can be. So what does this all mean for you day to day? It really underscores the value of a long-term commitment. Seeing your health, especially your arterial health, as something you actively build and protect every day. So maybe consider this. How might these insights shift your focus? Is it about chasing that elusive miracle unclogging cure you saw online? Or is it about empowering yourself with this knowledge to consistently build a healthier, more resilient you from the inside out, truly supporting your arteries for the long run?